So welcome to 152 Podcast. I'm Jayne Williams, the CEO of 152 Harley Street, and I'm joined this evening by Daniel Ezra. Evening, Daniel.
Jayne.
And Daniel is one of our specialists here at 152 Harley Street. He's much more than just a specialist here, and we'll talk more about that later. But first of all, our audience would love to know and to hear about your journey, your career, and obviously what you do.
Yes, well, so I'm an oculoplastic specialist here.
So you'll have to explain that to our...
Well, I was going to say you're not alone in finding that quite difficult to unravel. Oculoplastic surgery deals with disorders and abnormalities of the eyelids, effectively. And it's effectively a form of plastic surgery around the eyes. But the training comes from ophthalmic surgery. So oculoplastic specialists have trained in microsurgery of the eyes, and they're predominantly eye specialists who then do advanced subspecialty training in the eyelids, which is different to plastic surgeons who do more general plastic surgery, which they can then apply to the eye. And each specialty brings, its own strengths to the area. But I have been doing this now as a consultant for over 10 years. I'm based at Moorfields Eye Hospital. And I went through my registrar training in the North London area. I did a clinical lectureship, which is part academic post for a while, with quite a bit of research, believe it or not, in eyelids.
Wow.
There is such
Who
a
knew
thing.
we could research eyelids?
And I did a bit of plastic surgery training as well to help consolidate a lot of that knowledge. And then that's been very helpful at building my consultant career. On the NHS, we deal mostly with a variety of skin tumours, congenital deformities, malpositions of the eyelids, and also some quite complex conditions that require really involved aesthetic rehabilitation. And privately, it's predominantly aesthetic eyelid surgery like blepharoplasty, brow lifting, mid-face elevation, and all of those things that surround the eye. And I think hopefully that answers the question.
It does, but my next question is, what is a blepharoplasty? Because there'll be lots of people listening to this or watching this thinking, do I need one of those? Have I got that problem? And part of the podcast is to sort of do the myth busting and explain in layman's terms what you amazing surgeons do.
Yeah, so we do a huge amount of blepharoplasty surgery here at 152 Harley Street. And we have a team of several oculoplastic surgeons here, but to perform the surgery, broadly speaking, we can divide it into upper and lower eyelid surgery. The upper lid surgery predominantly deals with excising excess tissue and removing fat bulges in the upper eyelid space. And that's typically useful for patients who've got hooding, who feel that they have little bits of swelling in their upper eyelids, and it can be extremely effective. Lower lid blepharoplasty is more about dealing with lower lid bags and excess skin. The surgery tends to work best for patients who've got puffiness and bags rather than dynamic problems with the way the eyelids look, such as wrinkles or fine lines when they're smiling. But blepharoplasty surgery is the second most popular aesthetic surgery in the UK.
Well, I'm listening to you thinking maybe I need to book in for the bags.
Yes, not just yet.
Okay. Thank you for the reassurance.
I don't think we can allow you to have any time off.
No, true. Yeah.
But it is actually it's very effective and very safe. So it's one of those fantastic procedures that hit that balance between having a really, really good impact, being really safe and having a low downtime, which I think some other surgeries don't always do. Not everybody is a good candidate for the surgery, but we normally would have a clinic appointment. We'd have a look at everything, look at the eyes, the upper lids, the lower lids, and also the surrounding structures. So sometimes we need to do surgery to deal with the brows to make sure that they're elevated in the right place. And sometimes we need to do work around the cheeks as well. So it's not just the eyes, but it's about how the eyes fit in with the rest of the face. I think if you're going to do blepharoplasty to a really high standard, then it's about contextualising the eyes and having a really bespoke plan, which we develop with every patients.
And I've noticed since I've been here, your colleague Caroline, who's also an expert consultant that does the similar procedures to yourself, she was telling me that the one particular day she'd actually seen 4 or 5 different patients who really it wasn't right for them to have that procedure. And, you know, I was really in awe of how she managed them, because obviously they were disappointed, but at the same time she made that bespoke plan for them, which didn't necessarily mean they needed a blepharoplasty at this point, but was going to sort of manage them and look after them and take them on a journey, which I thought was really, really wonderful.
Yeah, and that is absolutely our philosophy in the clinic here. We do turn away quite a large proportion of our patients, and the reason is we need to ensure that we can meet the expectations of patients and that they get really good value for the surgery.
Yeah.
You know, we don't want to treat patients who are going to get just a minor improvement.
No.
And we have that kind of detailed discussion with patients to ensure they get good value, they get a good impact, and that what we can deliver meets expectations.
Yeah.
But as you say, you know, as people get older, that whole equation changes. The variables in that equation change,
Yes.
and something that might not be appropriate now may well be appropriate later. And as you allude to, I think what we really want to do with our patients is not just offer, you know, a one-stop shop and say, look, you know, you've had your treatment and that's it. If you're not appropriate, if the treatment's not appropriate for you, there may be non-surgical approaches that might help. But also it's, I think historically there's always been a dichotomy looking at, well, do we go for a non-surgical approach or a surgical approach? But actually our approach is a bit more nuanced. It's about how the non-surgical and surgical tools can work best together to deliver that optimal result for patients. And also, as you say, it's about a journey. It's about making sure that we don't do anything in the short term that might jeopardize a long-term impact. And we see this kind of thing all the time, particularly with filler injections given much earlier in life, which really, really can detrimentally affect prospects for blepharoplasty potentially in the future.
Right.
So we have an eye very much on the journey where patients are going to make sure that whatever treatments they have are going to really work for them in the long term as well.
And I think that's one of the wonderful things about 152 Harley Street and everything that we do here, because it is about nurturing that patient, and it is about the patient being in the centre. And there is a team of amazing experts here that can help the patient, because when it's cosmetic, whether that's because there's been an injury or because it's like you say, the aging process, it's really important, isn't it, that we wrap our arms around that patient and we take them on that journey, because it is very subjective. As an individual, you want to look your best, but it might be that you've had an injury, and you know it's the best outcome that we can possibly get versus just doing a procedure and letting them go home, you know. So I've seen some amazing results here with the patients, but also listened to some amazing comments about how they feel they come back and they have something else, or they might, you know, be just, you know, really pleased with the results. But we make sure that we take them on that journey, which I think, like you say, is really, really important. So at the beginning, we sort of chatted about, I introduced you more than just the ocular plastic surgeon specialist that you are here. You're also one of our key founders and have got so much experience. And I just wondered what your vision was when you wanted to set up 152 Harley Street, and why you decided to take this approach, and how we're looking at the future to fulfill our vision.
Well, I think it starts really from my own experience and my subspecialty. So I specialise in eye-related aesthetics privately, and it became very obvious when I started doing this work that patients were becoming more and more discerning, and if they wanted to have surgery, they would tend to seek out a specialist in that particular area. So, for example, if a patient wants to have a rhinoplasty,
a nose job,
they would tend to look for a specialist that only does rhinoplasty, or who might, for example, be able to examine the inside of the nose, understand airflow. If a patient would like to have their eyes done, they would go and find an eye specialist who specialises in oculoplastic surgery, is also able to examine the eye in detail as well. And there's a very strong trend moving in that direction. You know, people who want breast augmentation will go and see someone who only does breast surgery. And we're seeing a real trend and movement away from individuals who do many different types of surgery to people focusing on different areas. And that's something that we're seeing in the NHS all the time. We're seeing a really much more organised...
informed patient, aren't we?
Well, more informed patients, but also the medical profession is becoming more organised in subspecialties. And you often will need to use several subspecialists, even in the same area, to work together to get the right outcome for patients. But the cosmetic sector has really, in many ways, lagged behind. There are no clinics that you can go to that can bring together the right specialists to offer a totally comprehensive, cutting-edge management approach. They don't tend to exist. So most clinics out there will be run by, one or two individuals who may or may not be specialists who will offer an array of non-surgical treatments. But what we really wanted to do that was unique was to bring together a team of super specialists who are very highly regarded in their own fields, who can work together to ensure that patients get the best possible outcomes that they can. And it's really only by creating a team like that that kind of comprehensive service can be delivered to patients.
And you can really see that here. And we've got 152 Harley Street with those subspecialists, as you said, but also embedded within 152 Harley Street, we have the London Scar Clinic, which is a great example of how we bring those subspecialities together. They work as a team with the patient in the centre, because often, for patients that may have scars, there's a lot of different expertise required, whether it's psychological, physical, surgical, non-surgical.
Absolutely, and it's exactly the same for aesthetic interventions. As you say, we have ocular plastic surgeons here. We have got dermatologists who specialise in lasers, who are internationally renowned. We've got craniofacial surgeons. We have plastic surgeons. We have essentially every possible niche that you could imagine is filled by an internationally recognised specialist in that field. And
I think it's just incredible, having spoken to a patient recently who actually came here thinking that she wanted some filler, Botox, was her first time, felt really, nervous, wasn't really sure, chose 152 Harley Street because of the level of expertise, the individual experts that were here, but actually was advised that a laser treatment could actually help with her issues, not Botox or filler. And actually the thing that frightened her was having something in her that she hadn't had before, an injection, but had the laser treatment, was absolutely delighted. And I know, some of our treatments like the new EndoLift procedure, which is a, minimally invasive facelift, which is, when I came here, I was like, wow, put me down for one of those, please, when I need it. But incredible, not just the expertise of the individual practitioners and physicians, but also the equipment that we've got here matches that expertise.
It does, and as you say, we have a full laser suite here, and we have the ability to offer pretty much any treatment that's out there, and we're very, very up to date. And the sort of old joke that when all you have is a hammer, everything is a nail, which is often the case at some. In some places, but here we've got the entire toolbox,
absolutely,
every gadget available.
I am like a kid in a sweet shop at the moment, but
and we've got the expertise to use it. And even the nurse delivered treatments that we have here, we've got really well trained nurses, but they can defer to all of those super specialists if they need any help, or if they feel that different kinds of treatments are required. And that's the really unique thing about what we're doing here.
And I think that's really important. And I know from talking to some of the nurses how they really value that they've got that learning and development opportunity here to, enhance their own skills, learn more every day. But they've got the safety net of the expertise to ask questions, to, if they're concerned about a patient. It's a wonderful model. So what about the future, Daniel? We're working really hard at the moment, both of us, to put this on the map and make us that centre of excellence that we already have here, but telling the world about it. So what next?
I think the focus is to really build our nurse-led clinic, the nurse-led care, and with the vision being that patients will come with whatever aesthetic issue they may have, they'll have a nurse assessment, and they'll then have a plan developed which will try and combine whatever maintenance treatments they might require with whatever sort of particularly impact type treatment as well. So if they might need surgery, they might go to the right specialist.
Yeah.
But all the time having the right kind of governance, the right kind of supervision, and delivering to patients treatments that really are safe and effective and give really, really good value.
Yeah.
And take them on that journey, as you said. So we're trying to build that infrastructure, aren't we, to get that nurse-delivered care in.
We are. And I think complementing that is to build in those well-being support that's so important. You know, we read a lot about body dysmorphia. It's very topical. And we know in the cosmetic industry that a lot of people, you know, are struggling with who they are and how they feel in their own skin. So they come and visit. Hopefully always go to a ethical, wonderful, super specialist clinic like 152 Harley Street, but don't always, and end up with, you know, maybe the wrong treatment and the wrong information. So for me, coming in as well, it's about offering the right information, being able to manage the psychological support that may be needed and the nutritional support, and on that whole journey, you know, hormone therapy if you're terrible acne, to hormone replacement therapy when you're of a different age group. So it's exciting to be able to offer everything here but from the specialists, as you say, and I think that's really unique, is that we're bringing in those experts to complement one another and support the patient.
Yeah, and you know, again, that's, you know, that it really just mirrors, you know, best practice in the NHS, which is that you can't deal with complex problems unless you've got many people involved. And we regularly have multidisciplinary teams in the NHS, and that's what we're really building here as well.
Yeah.
It's that recognition that we need to utilise the right kind of expertise, and that expertise can often not be as well. That expertise often needs to be complemented by others in other areas.
Yeah. And I was at an MDT recently for us, and just listening to the experts, and 3 different patients were discussed. That's not one of our patients going past, if you picked up the ambulance there. Sorry about that. But I was just in awe really of the amount of support and the whole learning of each other, you know, listening to you all speak to one another, and the thoughts and techniques that you bring to the table for quite complex patients actually that had presented here. And it was great to see some solutions and some plans and trying to get the best possible outcomes for the patient. It was, really.
Yeah, I mean, it's just to pick up on that point. One, you know, I think as specialists become very experienced in their fields, I think they always try to, you know, evolve their practice, be it through research, new practice, or whatever it may be. But one very common area that I think consultants quite like to delve into is interdisciplinary working with other people from other specialties at this sort of synapse point where they may just meet every now and again. And because as you say, there's a huge amount of learning to be gained from that, to you know, to be operating together or to be sharing cases together. And that's a really, really fruitful area here.
Yeah, and to bring all of you from, you know, you say, as you said, you're at Moorfields, which is your NHS work, and so all the surgeons coming from across London in their area of expertise in different NHS hospitals, and then sort of congregating in one place here at 152, and just, well, yeah, I was very humbled to listen to you all discuss the patients.
And you know, it's for us, it's a fantastic place to work. We're incredibly well supported. We've got fantastic nursing staff.
Great CEO.
We've got.
Did I jump in too soon there?
That was coming later.
Oh, okay.
Later
Sorry.
On the list. Great equipment.
Yeah, great equipment.
Lovely consulting
Lovely rooms.
And a great CEO.
Oh, thank you. You had to say that.
I had to.
Yeah. Well, Daniel, as ever, it's been fabulous talking to you, and thank you so much for giving your precious time. I know you've been back to back all day, and you're back to back all day again tomorrow, so thank you very much, and we look forward to speaking again soon.
Always a pleasure to talk.
Thank you.